Let's talk about how important medical stories that you've probably heard us mention before. They're about the way that doctors stay up to date on the latest research, right? We always talk about these medical journals and how important they are. But did you know that Health and Human Services Secretary Robert F. Kennedy Jr. has plans to create new medical journals and may even stop publication of NIH-funded research in traditional journals? So that's a very, very big deal. 2/3 of doctors are overwhelmed by the flow of medical research, and journals help them give practical advice to patients. Our chief medical correspondent, Dr. Jon LaPook, is here with us to break it all down. But first, he wants to take a look at what these changes could look like. Watch.
From the New England Journal of Medicine, steeped in tradition, to the more obscure titles, there are more than 4,600 medical journals in the world, and about 1 million articles published each year. Health professionals look to these publications to stay up to date.
We've mapped out a game plan.
Want to share it? Health and Human Services Secretary Robert F. Kennedy Jr. told us it's time for a change.
We need to replicate studies. We need to publish raw data. We need to get away from the traditional journals, which are controlled by the pharmaceutical industry, and create our own journals, which we're going to do.
This is the first volume of the New England Journal of Medicine from 1812.
Dr. Eric Rubin is editor-in-chief of the New England Journal of Medicine, which has published for more than 2 centuries.
RFK Jr. said to me, the medical journals are controlled by the pharmaceutical companies. What would your response be?
That's incorrect.
The New England Journal of Medicine is published by the nonprofit Massachusetts Medical Society, and Dr. Rubin says there is a solid firewall between the editorial team and the journal's advertisers, which include pharmaceutical companies.
What's your reaction to RFK Jr.'s plan to create alternate medical journals?
I welcome more journals. There are a lot of journals, and I hope they bring something that's unique.
On a recent podcast, the HHS secretary voiced concerns about publication of federally funded research in traditional journals such as The Lancet, New England Journal, and JAMA.
Unless these journals change dramatically, we are going to stop NIH scientists from publishing there.
One new publication that premiered in February is the Journal of the Academy of Public Health. It was co-founded by Dr. Jay Bhattacharya before he was named head of the National Institutes of Health, and by Dr. Martin Kulldorff before Secretary Kennedy appointed him to the CDC's Vaccine Advisory Committee. The journal's editor-in-chief told us the publication has no affiliation with the Trump administration and is offering a more open discussion of issues than is typical of traditional journals.
We are very open to things that challenge orthodoxy. In many cases, that's where breakthroughs come from. And we're looking for those.
In addition to creating new journals, Secretary Kennedy has talked about wanting researchers to publish the raw data behind their studies, along with comments from reviewers, something not uniformly done in the thousands of journals published around the world.
So Secretary Kennedy has also signaled other changes in reporting when it comes to medical research, John. What are they?
Well, you know, this is the business about publishing the raw data that I just mentioned and about having a more open process. But, you know, last week, Dr. Rubin, who you just saw, and his counterpart at the Journal of the American Medical Association, published a viewpoint in the Washington Post and defending the journal process. And we put it up in prompter. I want to make sure I get this excerpt right. Just as democracy depends on a free and independent press to hold power accountable, medical progress depends on independent journals to vet, challenge, and advance science without political interference. And, you know, I touched base with Dr. Rubin over the weekend, and his position is, look, these articles that are in his journal, for example, are extensively vetted by experts. And if somebody believes that the process is biased, you know, if it's not legitimate, then go ahead and give specific criticisms rather than sort of a blanket, these are not to be trusted.
Do you see an issue with releasing the underlying data?
No, not at all. I think that's great to have the underlying data. There's pros and cons of having the people who do the peer review sort of out there publicly. Because one of the positions is like, look, I'm not going to be so honest because I'm criticizing somebody who's also in my field. Right. So there are pros and cons, although, you know, it's nice to see what people say. What is the exact process? But this whole phrase called radical transparency, right? That's great. And I think that's the point that Dr. Rubin said to me, you know, communicated to me over the weekend, which is don't just say, look, these journals are not to be trusted for for general reasons. Give me the specific criticism. This article, here was the problem, and let's go back and forth. And I think it's the same thing when you're seeing these, the advisory committees for immunization, that people want it to be an open process.
But at the end of the day, I know we got to go. But Jon, if you're going to be, if you will still trust the New England Journal of Medicine, and these other sort of fly-by-night journals might not be something that you would take under advisement if you're in your practice.
Yeah, and I wouldn't call them a fly-by-night journal. I really wouldn't. I would just say they're new journals. They need to be looked at and with an open mind. But yeah, the New England Journal of Medicine is something I trusted. I know there are a lot of experts involved there, and it is something that I do trust.
All right, Dr. Jon LaPook, thank you so much.